Today we're going to talk about the circulatory system. The circulatory system is divided into two subdivisions. The cardiovascular system, which includes the heart, the blood vessels. Their primary function is carrying oxygen, CO2, nutrients, waste, chemical messengers, and helps maintain fluid balance. The second subdivision includes the lymphatic system, which will include organs, vessels, glands. They function in carrying fat from the GI tract, drains fluids from tissue spaces, and filters bacteria and virus from plasma. So let's start with the heart. The heart is the pump of the cardiovascular system. Its function is to propel blood through an estimated amount of 100,000 kilograms of blood vessels. A specialist that studies the disease of the heart is called a cardiologist. If we could look at the heart, it's a hollow cone-shaped organ, and it's about the size of a closed fist. It sits in a region called the mediastinum, which is a region in the thoracic cavity that sits in between the lungs. Along with the heart, in the mediastinum also includes the esophagus, the trachea, the thymus, and large blood vessels. About 2/3 of the mass of the heart lies to the left of the midline. So this is that space that sits in the center called the mediastinum. If we look at the heart, it's important to note, especially when you're looking at a model, what is anterior and what is posterior. So when you see the large vessels, which includes the pulmonary trunk and the aorta, we know this is the anterior portion of the heart. This little A with the little star, this is the apex of the heart, or the lower portion. The pointed ends around the fifth intercostal space, where the base of the heart is in the upper portion of the heart. So here we're looking at the anterior view of the heart in the thoracic cavity. This whole region in here is the thoracic cavity. Remember, this is the diaphragm. These are the right and the left lungs, and the region in the center here is called the mediastinum. We could see the aorta, the arch of the aorta, and the pulmonary trunk. So this gives us an indication that this is the anterior portion of the heart. The heart has an anterior surface and an interior surface, a right border and a left border. The surface projections refer to the outlining, the shape of an organ on the surface of the body. So we could see a superior right point, superior left point, inferior left point, and inferior right point correlates with different portions of the ribs. So let's look at some structures and functions that exist within the heart. The pericardium is the sac that surrounds the heart and it protects the heart. We learned in the past that the pericardium is made up of dense, irregular connective tissue, and this pericardium has two layers. The outer layer is the fibrous pericardium, which is a very thick, inelastic tissue that prevents overstretching of the heart, and it also anchors the heart along the diaphragm. The inner layer, the deeper layer, is called the serous pericardium, which has two separate layers. One is called the parietal layer, which fuses to the fibrous pericardium, and the other one is called the visceral layer. Viscera means it sits right on top of the heart. And another name for the visceral layer is called the epicardium. The pericardial cavity is the region that exists between the two layers of the visceral pericardium and the outer layer, the parietal layer. In between the two, there's a little space called the pericardial cavity. And within this pericardial cavity, pericardial fluid is secreted, and this is a lubricating fluid that reduces the friction between the layers as the heart moves. So if we can see here, the visceral pericardium sits right on the heart itself. It's also called the epicardium. We have the parietal pericardium, which connects to the fibrous pericardium. It anchors the heart in that pericardial cavity. And then the little space in between has pericardial fluid. So let's talk about the layers of the heart wall. So here we have the fibrous pericardium, which connects the heart into the pericardial space. It also prevents the heart from overfilling. Then we have the parietal layer, which anchors itself to the fibrous layer, and the visceral layer, which sits right on the heart tissue itself. And this visceral layer, another name for that is the epicardium. A little space in between called the pericardial cavity, which has the pericardial fluid as a lubricating means. So we'll talk about the other layers of the heart. So this one out here is called the epicardium. The one in the center is called the myocardium, and the inner layer is called the endocardium. So let's talk about the epicardium. It's made up of mesothelium and connective tissues, which contain blood vessels, lymphatics, and nerves. And the connective tissue allows this tissue to be fibroelastic and has adipose tissue around the outside. The myocardium is the thick muscle layer, which we'll talk about in a minute. So this one makes up about 95% of the heart wall, and it's responsible for the pumping action. And also within the myocardium, we have the striated cardiac muscle tissue, and the fibers within the intercalated discs are the connections between the cardiac cells. The inner layer here is called the endocardium, and this is covered by endothelium, and this is continuous with the endothelium of the blood vessels. So let's break these down in a little more detail. The most superficial layer is called the epicardium. It's also covered by adipose tissue over the ventricular surfaces, and the coronary vessels sit in the epicardium. So this outer layer gives the heart a smooth and slippery texture, which will contain blood vessels, lymphatics, and nerves. The myocardium is this muscle layer. So it's made up of cardiac muscle cells, and remember, they have similarities to skeletal muscle in that they're both striated and have the actin and myosin proteins inside of it. They're only one nucleus per cell, and what makes myocardium different is that it has intercalated discs that connect one cell to the other, which has the gap junctions allowing the electrical impulse to pass from cell to cell quicker. So if we look at the myocardial layering around the heart, you can see how it's not just one uniform, but it's bundles around each chamber that makes it very efficient for pumping. The endocardium is this inner layer made up of endothelium and a thin layer of connective tissue. So this makes this region very smooth for the lumen or the chambers of the heart, and covers the valves of the heart. And this same endocardial tissue is continuous with the vessels that connect here. Certain conditions that are associated with these layers are pericarditis. So pericarditis is an inflammation of the pericardium, often by infection, and often this patient will have pain and fluid accumulation. It could either be viral or bacterial. A myocardial infarction or a heart attack refers to the region of the myocardium where there's lack of circulation, possibly due to a clogging of one of the coronary vessels. The endocardium covers the valves, and often an infection in this area is called an endocarditis. Rheumatic fever can cause this. That's why it's so important if you have strep throat that you get it tested and treated as soon as possible, because it could damage your heart valves. So let's look at the chambers of the heart. This is an anterior view of the heart. Okay. So there's 4 chambers. There's the right atrium, which is located right here. The right ventricle here. The left, what is that? Okay, sorry about that. Right atrium, right ventricle, left ventricle, and left atrium are the 4 chambers of the heart. So this is the atrium. Here is the left ventricle. This is the right ventricle and the right atrium. So when we're talking about the cardiac muscle itself, on histological slide, it looks like this, where you do see some striations. You see these little dark lines within the cardiocytes, and they're called the intercalated discs, which has the desmosomes. They're the cellular connections via gap junctions. Many mitochondria within the cardiac muscle cell. It does have the transverse tubules over the Z discs, and they have sarcoplasmic reticulum, but they do not have terminal cisternae AI bands. H zones and Z discs are present when we look at a cardiocyte. So you can see these are the heart cells. There's lots of mitochondria, 1 nuclei per cell. Within these intercalated discs is where we have these gap junctions, which allow the electrical impulse to pass from one cell to the next. So let's look at the chambers. We kind of reviewed it briefly. So there's a right chamber and a left chamber, a right ventricle, and a left ventricle. So in total, there's 4 heart chambers, 2 atria, and 2 ventricles. So the 2 superior chambers are called atria. They're the receiving blood to the heart via veins. We've got these little bags that sit on top of the 2 atria, and they're called auricles. The 2 inferior chambers are called ventricles, and they're powerful pumping chambers. We'll pump the blood in 2 systems. One is called the pulmonary pump, and this is located in the right atrium and the right ventricle, and this is pumping deoxygenated blood to the lungs. Deoxygenated means lacking oxygen. The systemic pump is located on the left side of the heart, which includes the left atrium and the left ventricle, and this is pumping oxygenated blood entirely to all the systems. So let's look at this macro anatomy, meaning we could see this with the naked eye. So here is the right atrium, and you see this little bag. It's kind of like, dog ears, auricles. The right auricle, and then there's a left auricle. And the important thing about the auricle is they allow those atrium to swell out as the blood is being pumped into the right atrium and the left atrium. Oh, the S is missing here. Psoas sulcus. Another anatomical feature of the heart are called sulcus. I apologize about this. It should be sulcus. So what sulcus means, it means a groove, like a little indentation. There's a few that we have to know. So they're going to be important when we're naming the coronary vessels in a little while. So the coronary sulcus is this one right here. It's a groove that separates the atrium from the ventricles. So it encircles the whole heart, and it's going to separate the atria from the ventricles. And we'll learn that within the coronary sulcus, the coronary sinus sits in there. Then we have an anterior interventricular sulcus. So what this means here is it's located anteriorly of the heart, and it's going to divide the right and left sulcus from each other. And then in the back, there's a posterior interventricular sulcus. And we'll learn that vessels sit in these little grooves. And this one is located in the back. So you can see this image here. The posterior interventricular sulcus is a little groove that sits in the back here. So this is a nice image. We haven't seen this image yet. This is, when you see this image, this is the posterior portion of the heart, because you're going to see the coronary sulcus, you're going to see the inferior and superior vena cava, and we know we're in the posterior portion of the heart, as opposed to this is the anterior portion of the heart, because you're going to see the pulmonary trunk in the aorta, and you can see this little groove in the front is called the anterior interventricular, meaning in between the ventricle sulcus. So let's divide these chambers. So the first one here is called the right atrium. This is the right atrium. Didn't print for what, I don't know why, but I'll write this. So this is the right atrium. Let's start here. So in the right atrium, let's talk about 3 venous sources that are entering the atrium. So we have the superior vena cava, and this is bringing the deoxygenated blood superior from the heart, and that's going to include the upper limbs and the head and neck. The inferior vena cava is bringing that deoxygenated blood, venous blood, from the lower parts of the body. And the third one is here, the coronary sinus, which is also a little hole in that right atrium. And this one is bringing blood, deoxygenated blood, from the coronary circulation. So let's talk about what deoxygenated blood means. It means it's lacking oxygen. And we'll understand also that a vein, what a vein does, is it's bringing blood to the heart. That's the main definition. It's not always going to be deoxygenated. Often in these books, it's going to look blue. So the right atrium, if we look at the anatomy, the internal wall has these pectinate muscles in between the chambers of the right atrium and the left atrium. And again, remember, we're always looking at the models right and left. So this would be right. It's not your right and left, and this is the left. There's a little septum or a little wall here, and that's called the interatrial septum. And this is going to be important when we study the conduction of the heart. Inside the right atrium, there's a little like remnant of what we call a fossa ovalis. It's like a little oval depression in the septum, and it's remnant of the foramen ovale, which in fetal circulation, the foramen ovale allows the blood to pass directly from the right to left atrium. So then the blood flows from this right atrium into the right ventricle via the tricuspid valve. So let's look at this. So here is the right atrium here. You could see the superior vena cava, inferior vena cava, and in fetal circulation, that was called the foramen ovale. There was an actual space here, and upon birth, it should close up, and it looks like this, which is called the fossa ovalis. It's a shallow depression that exists inside the right atrium. So the blood flow is coming into the right atrium via the superior vena cava, inferior vena cava, and also the coronary sinus, which is a little vein that's bringing the deoxygenated blood into the right atrium. Then it's going to cross, it's going to, both atrium pump at the same time, so they're pushing, in this case, the deoxygenated blood through the tricuspid valve. So another name for tricuspid valve is called the right, because it's on the right side, atrioventricular valve. Make sure you know both. So a mnemonic I like is try the right. So the tricuspid valve is also called the right atrioventricular valve. So here is the right atrium. Here's the right tricuspid valve, and we'll go into details about that in a minute. Why do we call it tricuspid? Is because it has 3 cusps. You can see there. So this is the tricuspid valve on the right, and on the left, it's going to be called the bicuspid valve because it only has 2 cusps. So let's look at the tricuspid valve here. What connects to it? So there's a papillary muscle that exists that connects to these cords called chordate tendinate. And the contraction and relaxation of this papillary muscle opens and closes these cusps, allowing the blood flow to enter from the atrium to the ventricle. So we're in the right ventricle now. So this is the most anterior surface of the heart. The trabecular carne is an irregular surface that we would see inside within the cardiac muscle fiber. And we'll learn shortly the trabeculae carne, meaning like muscle that looks trabecular visually. This is going to, we'll talk about this because it's part of the conduction system. We talked about the chordate tendinae, which are the cords that connect to the cusps, and they act like tendons. So when they pull on it, they will close it, relaxing, it opens, and they're connected to the papillary muscles. There is a separation in between the right and left ventricles, and they're called interventricular septum. And this divides the heart in between the right and left side. There's a pulmonary semilunar valve, and this is the separation in between the right ventricle and the pulmonary trunk. So let's look at this. Here is the tricuspid valve, the chordate tendinae connected to the papillary muscles. So the blood is coming into this ventricle. We do have to know that the blood that is in the right ventricle is deoxygenated. So then the ventricles are going to contract. So it's going to go through the pulmonary valve, and it's going to be pushed into the pulmonary trunk. And just like the name says, this deoxygenated blood is being taken to the lungs, right? Via the pulmonary circulation. And what happens in the lungs? This blood is going to become oxygenated, and it's going to absorb oxygen and expel CO2, and then that's going to bring that blood back to the left atrium. Okay, so this pulmonary trunk is going to divide into right and left pulmonary arteries, and it's carrying this deoxygenated blood to the lungs. So as we talked about veins, the definition is carrying blood to the heart, okay? Where an artery, the definition, the actual definition, is carrying blood away from the heart, okay? So understanding this definition, the pulmonary arteries, they are carrying blood away from the heart, even though this blood is deoxygenated. So on our models, when we see these pulmonary arteries, they're going to be blue, and it's often misunderstood in practicals, but we'll look at that when we look at the lab. So this is a cadaver image of the chordate tendonae. They're actual cords. They look like cords. So now we're in the right ventricle, okay? So the deoxygenated blood has come from the right atrium. It's passed into the right ventricle, and now it's going to go through this pulmonary valve into the pulmonary arteries. So remember, arteries carry blood away from the heart, but in this case, it's carrying that deoxygenated blood. So it's going to separate into a right and left pulmonary arteries, going to the right and left lungs. So the left atrium, so let's say this blood via the pulmonary artery has gone to the lungs, right? And it's become oxygenated. So then a pulmonary vein, right? So a vein is carrying blood to the heart, but in this case, the pulmonary vein is going to have oxygenated blood. So this is coming in here, okay? So there's going to be 2 from the right and 2 pulmonary arteries, pulmonary veins, Pulmonary veins are carrying blood to the heart from the right and left lungs. So these pulmonary veins are going to carry oxygenated blood, right, into the left atrium. So then the left atrium is going to contract, pushing this oxygenated blood out the valve. And on this side, the valve is called the bicuspid valve. Another name for this is called the mitral valve. And a third name, which you have to know all 3, is the left atrioventricular valve. So again, we call it a bicuspid valve because it only has 2 cusps. Mitral valve is I'm sure you've heard of mitral valve prolapse. It's a common valve that needs surgery. And then because it's located on the left side, it's the left atrioventricular valve. So the bicuspid valve is called bi because it only has 2 cusps. They're also connected to the chordate tendonae, which attach to papillary muscles. So when this is relaxed, the cords are not taut, but then when the papillary muscles contract, they tighten the chordate tendonae, and then we close the biceps, the bicuspid valve. I'm sorry. So acute mnemonic is try the right, tricuspid for the right. What was another name for the tricuspid valve? The right atrioventricular valve, or by the left. Another name would be the left atrioventricular valve or also the mitral valve. It's hard to draw with this. Okay. So now we're in the left ventricle. So here's the left ventricle. So what kind of blood is here? It's going to be oxygenated, right? So the oxygenated, freshly oxygenated blood is coming into the left atrium via the pulmonary veins, and then it's going to go through the bicuspid valve into the left ventricle. So let's look at some of these anatomical regions. So we already talked about how this is the apex of the heart. There's the trabeculate carinae. You can see it in here. Okay, it's kind of like an irregular pattern. We can see the chordate tendineae, which connects to the papillary muscles in the bicuspid valve. So the blood is coming through here, and then it's the left ventricle is going to contract, sending this blood out the aortic valve into the ascending aorta. Let's go back here. So, and from the ascending aorta, it's called the aortic semilunar valve. And this is going to send this blood systemically, which we'll get to. So make sure we understand the valves, the 4 valves that exist, and also what kind of blood is flowing through each of these valves, whether it's oxygenated or deoxygenated, and know what is the valve preventing, what are the 2 chambers that are connected to those valves. So let's start with the first one, the tricuspid valve. Remember, that's located on the right. What kind of blood is going through this? That has the deoxygenated blood, and it's preventing blood backflow into the right atrium, and it's separating the right atrium from the right ventricle. The second one, so let's back up here. Deoxygenated blood is coming from the superior vena cava, inferior vena cava, and the coronary sinus into this right atrium. Then the blood is going to go through the tricuspid valve, right? Another name for this is the right atrioventricular valve. Then the right ventricle is going to contract, and it's going to push the valve, this blood through the pulmonary semilunar valve, okay? And that's taking it to the lungs, right? And this is the pulmonary trunk, and it's going to divide into a right and left pulmonary arteries. We call them arteries because they're taking it away from the heart. So this pulmonary semilunar valve is going to carry deoxygenated blood, right? So it's blue here. And this blood is going to go to the lungs. It's going to become oxygenated, and it's going to return via the pulmonary veins into the left atrium. So the left atrium, now as you can see in red, has oxygenated blood because it's fresh blood coming back from the lungs. The atriums are going to contract and push this oxygenated blood through the bicuspid valve. So the bicuspid valve has oxygenated blood, right? It separates the left atrium from the left ventricle, and it's preventing backflow into that left atrium. Then this blood is going to be pushed through the aortic semilunar valves into the ascending aorta, arch of the aorta, and then systemically. So what kind of blood is in the aortic semilunar valve? That's going to be oxygenated, correct? And also the aortic semilunar valve is preventing backflow into that left ventricle. The pulmonary semilunar valve is preventing backflow into the right ventricle. Okay? So review this and kind of draw this out. It will help you understand and memorize this pathway. So now we're in the left ventricle. So from the left ventricle, the blood is going to be pushed out of the aortic semilunar valve, right? And it's going to go into the aorta, okay? So the first arteries off of that ascending aorta we'll learn are the right and left coronary arteries. Coronary arteries are part of the coronary circulation that has a separate little circulatory system around us that supply the walls of the heart. Then the rest of the blood is going to go up into the arch of the aorta. So here's the arch of the aorta, the ascending aorta. Then it's going to go into the thoracic aorta here, abdominal aorta, and then it's going to go into the extremities. So there's another fetal connection here. So there's a little ligament here, which I'll show you in a minute. It's called the ligamentum arteriosum, which is a remnant of the ductus arteriosus. And I'll show you what that looks like, hopefully here. So here it is. This is the anterior portion of the heart, right? Because we can see the ascending aorta and the pulmonary trunk. This is the ligamentum arteriosum, which is a remnant of the ductus arteriosum. In fetal circulation, the lungs are not operational yet. So the blood can go directly from the arch of the aorta into, or it's going from the pulmonary trunk directly into the arch of the aorta and then systemically. So now talking about the systemic circulation, it's coming from the left ventricle, right? Aortic semilunar valve. Initially, it's going to go into the coronary circulation of the heart. Then it's going to go on the ascending aorta, and then the arch of the aorta, and then down the thoracic aorta and the thoracic cavity, abdominal aorta, and then separate into a right and left common iliac arteries as it goes into the lower extremities. So let's look at this arch. Is the ABCS. I think I have a better image here. So the first vessels off of this ascending aorta is the right and left coronary arteries going into the coronary circulation. Then we have the ascending aorta. Then we have this ABCS. I always like mnemonics. So A is for the arch of the aorta. B is the brachiocephalic artery. We call it brachiocephalic because it's going to the right arm and right head, cephalic, brachium and cephalic. This middle portion of the arch of the aorta is going to the head, which is called the left common carotid. And the third vessel off of the arch of the aorta is called the left subclavian. So subclavian means going underneath the clavicle into the left arm. It's anatomically not symmetrical here. So on the right side, even though it starts with the brachiocephalic artery, this is going to divide into a right subclavian going into the right arm and a right common carotid. So if we took a transverse cut off the heart, the apex of the heart here, I want you to notice the difference between the width of the myocardium and the difference between the left ventricle and the right ventricle. So do you notice how the myocardial tissue on the right side is a lot thinner than it is on the left? So why would that occur? It makes sense that the right ventricle is pumping this deoxygenated blood into the pulmonary trunk via the pulmonary valve, semilunar valve, and the distance is very short, correct? Because the lung is right there. Versus once this blood comes back into the right atrium, into the right ventricle, out the aortic semilunar valve, then this left ventricle has to pump this blood systemically all over that we just talked about, the vessels. So this left ventricle has to pump a lot greater with a lot more force. Similar to our skeletal muscles, the cardiac muscle, the more you use it, the thicker it's going to get. So there is a test question, which ventricle is going to be thicker, the left or the right, and now we know why. Also the mitral valve, the valve that's located in between the left atrium, left ventricle, that mitral valve or bicuspid valve, because of the greater turbulence on that side, usually is the valve that needs to be, it becomes damaged more frequently. Okay, we will continue on video number 2 in the near future.